Dr. Rekha will now present to us on everything we need to know about donor corneal endothelium analysis.
Good morning. I thank the EBI for giving me this opportunity. So, I'll be speaking on donor cornea endothelial analysis from retrieval to dispatch. So, we know the endothelial cell density serves as a measurement for the functional status of a cornea, and that's what we look when we get a cornea for transplant. So this study we did because sometimes what happens during maybe holidays or festival seasons, we get very good corneas, and immediately there's no utilization, and even doctors outside don't require it. So we analyze the endothelial soon after retrieval, 48 hours later, 78 hours later, and 42 72 hours later, also three times. So beyond 72 hours, usually within 72 hours, we utilized all the corneas. So, and the corneas chosen for the study were of excellent and a very good grade. The corneas which were on the borderline endothelial, we did not uh, use that for analyzing. And the second evaluation was done 48 hours later, and the third was done after 72 hours. We have an in our SOP also, it maintains that we need to reevaluate the cornea before distributing it to the surgeon anytime after 24 hours if a surgeon needs a cornea. So basically, a slit lamp examination and a Conan a specular microscope was used, and donor corneas were all retrieved from HCRP only. We analyzed. We did not consider the voluntary donation. So, a screening protocol which is followed by all eye banks. That's pre-retrieval pen torch. Only suitable corneas retrieved. In situ was done. Cornea preserved in cortisol. Medical screening was done. Slit lamp evaluation, serology, and a specular analysis was done. So 124 donors were analyzed, and we saw that 87 eyes were collected within 6 hours of death. 52 eyes were collected within 6 to 8 hours of death, and beyond 8 to 12 hours were 27 eyes. These were the corneas donors who were preserved in cold storage, and the storage preservation was done within 6 hours of death. And we analyzed the donor age. Most of our donors were between 21 to 40 years of age, and the majority, that's almost 50.5% of the donors, belong to that age group. And our youngest donor was 13 years of age. So when it came to cause of death, hanging was the most common cause of death. Second came heart attack, road traffic accident, poisoning. They were all organophosphorus poisoning, and we've been using this organophosphorus from day one. We've been using it, and donor age versus specular when it was seen, we found that younger donors, that 10 to 40 years, we had an endothelial count of about 3000 cells, and from 41 to 50 41 to 51, it was about 2800, still about 2500, and 51 to 71, it was about 2700 cells. So even the older donors, we had a good endothelial cells, and CV and 6x were also uh, quite good. So the first specular, which was done 6 to 9 hours after retrieval, we found the average CD to be 2961, CV was 35, and 6A was 55%. The second specular was done 48 hours later, and we found no significant change between the cell density or the hexagonal cell or the CV cells. There was not much of no significance. So up to 48 hours, it was as good as 24 hours the cornea endothelial cell density and other parameters. Now, after 72 hours, we found that the cell density decreased much more in hanging cases. OP poisoning was the maximum decrease in cell density. Then came the cardiac arrest and the RTA cases. So, these hanging cases, we have done a study where we found the deterioration of the cornea to be much more. I think that is again because one is because the time of death is exactly not known. The second one is because when they hang themselves, the intraocular pressure goes up, and that also damages the specular counts. I mean, the endothelial count is gets damaged. The other thing we also noticed, there was a decrease in CV and hexagonal cells in all the groups after 72 hours. So this the for the pre-cut tissue, we did about 91 corneas we analyzed from 20 to 50 years. So we found the pre-cut, but all these pre-cut tissues were done within 48 hours of retrieval. There was not. It was done. Pre-cut was done. Specular was done just before doing the using the microkeratome, and it was again repeated soon after doing microkeratome, and we found that there was not much of a difference. So maybe the technicality was good, and we didn't find any difference between the pre-cut and the post-cut. But we have not used the microkeratome or done the pre-cut after 72 hours. So finally, I would like to say that the endothelial cell density is one of the methods by which the viability of the cornea can be checked. Hanging cases and OP poisoning, the endothelial count definitely decreases with CV and hexagonal cell after 72 hours. So the age and time of retrieval to preservation did not contribute much for deterioration of the cornea up to 72 hours. After 72 hours, the hexagonal cells, the CD and the CV decreases. Microkeratomes cut was done all within 48 hours, and we did not find much of a difference between the pre-cut and the post-cut. So I feel utilization of the cornea and all the preservation was in cortisol. So I feel the utilization of the cornea within 72 hours would be ideal for good surgical outcome. Thank you.
Thank you, Rekha. All these was done by a single observer because there's so much variation in if multiple observers do the endothelial cell.
No, multiple people have done the thing.
Yeah, so some amount of variability will occur.
Yes,
because
yes.
even if I do an endothelial cell now and
But
after 48 hours.
there are only two technicians who do this. So only both of them did all the study.
Okay.
So I think the variability may be less as such.
Okay.
You collect in cortisol from the beginning for the
Yes. We directly put into cortisol.
The study is good. Only one thing is that hanging thing, I don't know how significant difference.
Yeah.
But like Dr. Muscati told, there is huge variation.
Yeah.
Specular, unless you do 3 times because you don't know which area you focus.
Yeah.
The same person,
You
person or
focus on a different area the next time, and then you
Yeah.
get a different.
We only.
But by the rule of thumb, what your conclusion is acceptable, that there's not much change, so everyone should be happy that up to 72 hours you're okay. Also, the medium is cortisol, while most of us put it in MK, and then if it's not utilized, then we transfer it into after 48 hours. If there's no demand or something, then we transfer it into cortisol.
I think we reject quite a bit corneas in the hospital itself. Like sometimes they take a photograph and send it to us. We find there's some infiltration, something, we tell them. We were doing the MK media and cortisol, but I thought the cost factor was going up a little bit. So that's why we stopped and started using only cortisol.
So it again depends on eye bank. So most of the time our corneas go within 48 hours. So we put less than 50% of them from MK into cortisol. Yeah.
Okay.
That's why.
Thank you, sir.
Okay.
Any comments from anybody else?
Yes.
Yeah.
Where are the NK media in 1982?
LV Prasad Eye Institute.
1982, I gave a project to manufacture NK media.
Yes.
To RP Center.
Okay.
1982. Then 1992, I gave it to LV Prasad. Now, nowhere they do. But Sun Pharma people told if you give permission, we will manufacture.
No, LV Prasad is doing it.
At the moment, at the moment, LV Prasad is supplying all over the country, the MK medium. But if is your technology of making it different from what LV Prasad is using? Is it different? Is it cheaper? Is it more?
That is a technical 1980 technical.
Yeah. So you'll have to talk. So you'll have to talk to LV Prasad and find out whether they're using your technique or some other technique to make it.
1982, they were not manufacturing.
No, 82
No.
anyway, LV Prasad
No.
was not there.
There was no LV Prasad in 82.
Did.
So it came in 86.
Yes.
1982, LV Prasad. 82 in RP Center.
IRP Center. Yeah. Okay.